hands. Good afternoon. This is a special coverage of the coronavirus crisis using the combined forces of News 5 and Signal TV's 1 News, Radyo 5 and 1PH. The Philippine General Hospital imposes stricter measures in guarding their COVID-19 patients. This is after one escaped from the hospital over the weekend. News 5's Jenny Dongon is reporting to us live from the PGH to tell us more. Jenny, paano raw nakatakas tong COVID-19 patient na to?
Jess, mukhang humanap talaga ng paraan para makatakas itong COVID-19 patient dito sa PGH. Sa katunayan, pinag-aralan niya yung mga schedule ng mga security personnel na nag-iikot dito sa ospital at inalam pa kung saan yung mga tagong exit nitong pasilidad. Kwento nga ng tagapagsalita ng PGH na si Dr. Jonas Del Rosario, tiniyempuhan ng 31 years old na COVID-19 patient na walang security guard na umiikot sa COVID-19 ward 6:30 ng gabi noong Sabado. Hinanap din daw ng pasyente yung sinasabing secret door ng PGH kung saan siya pwedeng makalabas nang walang nakakita. Nang makalabas, umangkas siya sa isang truck at bumaba sa Binondo at naglakad na pauwi ng kanilang tahanan sa barangay 275 kung saan nanatili siya doon kasama ang kanyang asawa, ina, kapatid at tiyuhin ng 2 oras. Agad inalarma naman ng PGH ang mga otoridad sa barangay tungkol sa tumakas na pasyente. Naibalik rin siya sa ospital matapos matunton noong Linggo ng madaling araw. Dahil sa insidente, magtatalaga na ng 24/7 security personnel ang PGH. Bantay sarado na rin ng security ang lahat ng exit point. Pinag-iisipan na rin nila na pagsuotin na ng hospital gown ang kanilang mga pasyente. Sa ngayon daw kasi, hindi nila pinagsusuot ng hospital gown ang kanilang mga pasyente para maging komportable sila kahit nasa loob ng ospital. Pinag-ibayuhin o pag-ibayuhin din ng ospital ang psychological needs ng mga pasyente. Sa ngayon, Jess, ay bantay sarado na ng mga personnel o otoridad itong ng PNP at mga barangay officials itong bahay ng pasyente para mabantayan na rin itong kanyang mga kapatid o yung kanyang ina at asawa na naka-home quarantine ngayon. Nagkaroon na rin ng contact tracing ang barangay officials dito sa mga nakasalamuha nitong pasyente habang nasa loob nga siya ng kanilang tahanan at dinisinfect na rin yung 2 barangay na kanyang dinaanan. Jess.
Maraming salamat. That was Jenny Dongon reporting to us live from Manila. AFP Chief of Staff Filimon Santos Jr. takes flak over a leaked letter addressed to the Chinese embassy, seeking its help to obtain a certain medicine that can allegedly alleviate COVID-19 symptoms. The letter, addressed to Ambassador Wang Xilian, says Santos is asking for help on purchasing 5 boxes of carimycin tablets for his friends. The medicine, which was recommended by his doctor when he was suffering from COVID-19, is only available in China. AFP spokesperson Edgar Darevalo says Santos withdrew his letter after learning that the Food and Drug Administration has not approved the use of the said tablets in the country. In a virtual press briefing, Defense Secretary Delfin Lorenzana says he has talked to Santos, whose act was out of line. However, he assures that it has no effect in our national security.
Hindi naman siguro very improper yung ginawa niya, wala lang sa lugar. Dahil dapat yung ganong mga sulat ay idadaan muna sa Department of Foreign Affairs. Wala naman siyang kasalanan na nag-violate ng regulation or imperil our national security. Kaya we will let the matter rest na.
Meanwhile, presidential spokesman Harry Roque also defended Santos. He said that the AFP head had no evil motive behind his actions. A UP political science professor is reminding government that mass testing and a medium to long-term recovery plan are crucial strategies before easing lockdown orders. UP Diliman PolSci Associate Professor Ranjit Rai spoke with Agenda Cito Beltran, saying government must invest in basic health parameters before granting a general community quarantine status in some areas. Rai added that lockdown implementations must be ethical and humane. There have been concerns over supposed police brutality throughout the implementation of the enhanced community quarantine in Luzon. Government has since branded the role of uniformed personnel in the ECQ as crucial, given the number of persons violating stay-at-home orders.
We cannot move forward. We cannot have shorter ECQs without necessary health parameters in place. And what are those health parameters? The most important, of course, is mass testing, effective contact tracing, and supportive isolation. Kaya we're cautioning government right now on your own show. Now we have to get the evidence, the data first before we decide to move from ECQ to GCQ or to even grant GCQ to places.
And that's the latest on the enhanced and expanded community quarantine. For more updates, follow News 5, the Philippine Star, and Business World Online. I'm Jess De Los Santos. We are One News.